Inserts at the ramus of the mandible, and it elevates the mandible and closes the jaw. This is the Splenius. It originates at the spinous processes of the cervical and thoracic vertebrae. It inserts at the mastoid process of the temporal bone, the occipital bone, and the superior cervical vertebrae. Together, the two sides extend the neck, and then alone, each one rotates and laterally flexes to that side. The brachiocephalicus. It originates at the deltoid tuberosity of the humerus. It inserts at the mastoid process of the temporal bone. Together, it flexes the neck. Alone, one side bends the head towards the shoulder and turns the face to the opposite side. This is the sternocephalicus. It originates at the sternum and inserts at the mastoid process of the temporal bone. Together, it flexes the neck, and alone, one side bends the head towards the shoulder and turns the face to the opposite side. This is the anterior deep pectoral. It originates at the ribs, the anterior superior surfaces, and inserts on the coracoid process of the scapula. It protracts the shoulder and downward rotation of the scapula. This is serratus ventralis. It originates on the ribs, the anterior and superior margins, and it inserts at the anterior surface of the ventral border of the scapula. It protracts the shoulders and does upward rotation of the scapula. This is the trapezius. It originates at the occipital bone and the spinous processes of the thoracic vertebrae. It inserts at the clavicle, the acromion process of the scapula, and the spine of the scapula. It elevates, retracts, and depresses the scapula and extends the neck. This is the rhomboideus. It originates at the spinous process of the cervical and thoracic vertebrae, and it inserts at the medial border of the scapula. It shifts the scapula towards the midline, so it adducts the scapula and performs downward rotation of the scapula. This is the superficial pectoral. It originates at the sternum and inserts at the greater tubercle of the humerus. It does flexion of the arm, adduction of the arm, and medial rotation at the shoulder. This is our posterior deep pectoral. It originates further down the sternum and inserts at the greater tubercle of the humerus. It does flexion of the arm, adduction of the arm, and medial rotation at the shoulder. This is our Coracobrachialis. It originates at the coracoid process of the scapula and inserts at the medial shaft of the humerus. It does adduction and flexion at the shoulders. This is the latissimus dorsi. It originates at the spinous processes of inferior thoracic and all lumbar vertebrae and at the ribs. The insertion is at the intertubercular groove of the humerus. It does extension, adduction, and medial rotation of the arm. This is the deltoid. It originates at the clavicle and the acromion process and spine of the scapula. It inserts at the deltoid tuberosity of the humerus. It does abduction at the shoulder. The anterior piece does flexion and medial rotation at the shoulder, and the posterior piece does extension and lateral rotation at the shoulder. This is the infraspinatus. It originates at the infraspinous fossa of the scapula and inserts at the greater tubercle of the humerus. It does lateral rotation of the shoulder. This is the supraspinatus. It originates at the supraspinous fossa of the scapula and inserts at the greater tubercle of the humerus. It does abduction at the shoulder. This is the teres major. It originates at the inferior angle of the scapula and inserts at the intertubercular groove of the humerus. It does extension, adduction, and medial rotation at the shoulder. This is the teres minor. It originates at the lateral border of the scapula and inserts at the greater tubercle of the humerus. It does lateral rotation at the shoulder. This is the triceps. This is the lateral head of the triceps. It originates at the superior lateral margin of the humerus. This is the long head of the triceps, and it originates at the superior lateral margin of the humerus. This is the medial head of the triceps, and it originates at the posterior surface of the humerus. All of them insert at the olecranon process of the ulna. They do extension at the elbow, and the long head does extension and adduction at the shoulder. This is the Biceps Brachii. The short head originates at the coracoid process of the scapula, and the long head originates above the glenoid cavity of the scapula. Both insert at the tuberosity of the radius. They do flexion at the elbow, supination of the forearm, but not in pigs, and flexion at the shoulder. This is the Brachialis. It originates at the anterior distal surface of the humerus and inserts at the tuberosity of the ulna. It does flexion at the elbow. This is Extensor Carpi Radialis. It originates at the lateral epicondyle of the humerus and inserts at the metacarpal. It does extension and abduction of the hand at the wrist. This is Extensor Carpi Ulnaris. It originates at the lateral epicondyle of the humerus and inserts at a metacarpal. It extends and adducts the hand at the wrist. This is Flexor Carpi Radialis. It originates at the medial epicondyle of the humerus and inserts at the metacarpals. It does flexion and abduction of the hand at the wrist. This is Flexor Carpi Ulnaris. It originates at the medial epicondyle of the humerus and inserts at the metacarpal. It does flexion and adduction of the hand at the wrist. These are the Flexor Digitorum muscles, or the digital flexors in the pig. They originate at the medial epicondyle of the humerus, the proximal radius and ulna, and the coronoid process of the ulna, and they insert at the middle phalanges and the distal phalanges. They do flexion at the phalanges. These are the Extensor Digitorum muscles, or the digital extensors in the pigs. They originate at the lateral epicondyle of the humerus and insert at the phalanges, and they do extension at the phalanges. This is the Rectus Abdominis. It originates at the pubic crest and inserts at the costal cartilages and xiphoid process of the sternum. It depresses the ribs, flexes the vertebral column, and compresses the abdomen. These are the external obliques. They originate at the ribs, the exterior and inferior margins, and insert at the linea alba, the midline connective tissue, and the iliac crest. They compress the abdomen, depress the ribs, flex and bend the spine. These are the internal obliques. They originate at the iliac crest in the thoracolumbar fascia and insert at the inferior ribs, the xiphoid process of the sternum, and the linea alba, the midline connective tissue. They compress the abdomen, depress the ribs, and flex and bend the spine. These are the Transverse Abdominis. You can see the fibers running transversely across the stomach. They originate at the ribs, the iliac crest, and thoracolumbar fascia. They insert at the pubis and linea alba, the midline connective tissue. They compress the abdomen. This is our tensor fascia latae. It's cut. It originates at the iliac crest and anterior superior iliac spine, and it inserts at the iliotibial tract. It does flexion and medial rotation at the hip. This is our gluteus maximus. It's cut through and reflected. It originates at the iliac crest, the lateral surface of the ilium, the sacrum, the coccyx, and the thoracolumbar fascia. It inserts at the iliotibial tract in the proximal end of the linea aspera, distal to the trochanters of the femur. It does extension and lateral rotation at the hip. This is the Gluteus Medius. It originates at the iliac crest in the outer surface of the ilium. It inserts at the greater trochanter of the femur. It does abduction and medial rotation at the hip. This is the restart.
Just keep going, I can cut it.
Okay. This is the adductor. That originates at the inferior ramus of the pubis and ischial tuberosity and inserts at the linea aspera of the femur. It does adduction, flexion, and medial rotation at the hip. This is the Psoas Major. It originates at the transverse processes of lumbar vertebrae and it inserts at the lesser trochanter of the femur. It does flexion at the hip. This is the iliacus. It's cut through. It originates at the iliac fossa and inserts distal to the lesser trochanter of the femur. It does flexion at the hip. This is the Biceps Femoris. It originates at the ischial tuberosity in the linea aspera of the femur. It inserts at the head of the fibula and the lateral condyle of the tibia. It does flexion at the knee and extension and lateral rotation of the hip. This is the semitendinosus. It originates at the ischial tuberosity and inserts at the proximal medial surface of the tibia. It does flexion at the knee, extension and medial rotation at the hip. This is the semimembranosus. It originates at the ischial tuberosity and inserts at the medial condyle of the tibia. It does flexion at the knee, extension and medial rotation at the hip. This is the Gracilis. It originates at the inferior ramus of the pubis and inserts at the inferior to medial condyle of the tibia. It does adduction at the hip, medial rotation of the hip, and flexion of the knee. Here, the gracilis is going to be reflected down in order to see the sartorius. It originates at the anterior superior iliac spine and inserts at the medial to tibial tuberosity of the tibia. It does lateral rotation at the hip, flexion at the hip, and flexion at the knee. This is the rectus femoris. It's going to be on top of the femur. It originates at the inferior iliac spine and inserts at the tibial tuberosity of the tibia. It does extension at the knee and flexion at the hip. This is the Vastus Lateralis. It originates at the linea aspera of the femur and the anterior and inferior to the greater trochanter of the femur. It inserts at the tibial tuberosity of the tibia. It does extension at the knee. This is the Vastus Medialis. It originates at the linea aspera of the femur, the entire length. It inserts at the tibial tuberosity of the tibia, and it does extension at the knee. This is the gastrocnemius. It originates at the medial and lateral condyles of the femur and inserts at the calcaneus. It does extension at the ankle, so plantar flexion, inversion of the foot, and flexion at the knee. Deep to the gastrocnemius is the soleus. It originates at the head and proximal shaft of the fibula and adjacent shaft of the tibia. It inserts at the calcaneus, and it does extension at the ankle, so plantar flexion. This is Tibialis Anterior. It originates at the lateral condyle and proximal shaft of the tibia and inserts at the metatarsal and medial cuneiform. It does flexion at the ankle, so dorsiflexion, and inversion of the foot. This is Peroneus longus. It originates at the lateral condyle of the tibia and the head and proximal shaft of the fibula. It inserts at the metatarsals and the medial cuneiform. It does eversion of the foot and extension of the ankle, so plantar flexion. This is Peroneus tertius. It originates at the distal anterior surface of the fibula and inserts at the metatarsal. It does eversion of the foot and flexion of the ankle, so dorsiflexion. This is Extensor Digitorum. It originates at the upper portion of the fibula and it inserts at the toes. It does extension of the toes and extension of the ankle. This is Flexor Digitorum. It originates at the proximal posterior surface of the tibia and inserts at the toes. It does flexion of the toes and extension of the ankle.